I don't know if you've noticed this, but in the last few years, you get some of these people who come into this space, but they're not like, let's say, an Eric Helms, where they've been in this game and like really looking at the research and the evidence for a long time, but they're tangentially related. So like an Andrew Huberman would be an example, right? Where, he's talking about this palm cooling device and just these amazing gains from this palm cooling device. And this one athlete, he went from doing 147 dips in a workout to doing 600 dips the next workout, and all this stuff. And you just hear that and you think, okay, anybody who's been in this space for a long time just knows that that's obviously ridiculous, right? But I think if you're just new to this, you're like, oh, well, this is a smart guy and he's got a PhD and he knows these other areas. And we talk about something called promiscuous expertise, right? Where somebody is an expert in one or two areas. They start talking about other areas and somebody just assumes that they're necessarily correct in that. And fitness is such a popular thing. You get some of these people who come into this space, and if you're not super involved in it, you might not know it's not necessarily accurate,
Yeah, I think it always amazes me once we step out of our circle, how different the actual world is. Like the questions that I'm sure you field from friends, family, are just kind of like make your head tip. Like, huh? Like, what? Like, is that really like? Is that not well known?
Yeah.
But it all comes with the progression of your I guess thirst for knowledge, and I think this kind of growth that we're talking about, I think it's very similar to my experience in physical therapy too, and possibly even yours with dentistry. I mean, in school, we're taught to be kind of like mechanics, very like tissue-based diagnoses, very specific tests and measures to pick out the tissue, the joint that's the problematic area, and then we have these specific interventions and manual techniques to fix them, and you leave school like thinking you're gonna cure the world like with these hands, and I can't wait to go to family parties and people ask me about their pain, like line up across my grandmother's dining room and like come to me and I'll fix every pain you ever had. So that's kind of like the muscle and fitness bodybuilding.com T Nation stuff. Like you just dive into that and it's so like, I don't know, delicious. Like, it's so satisfying to consume that kind of knowledge. And then you feel like you're a level up from the world and you want to just give everyone this cool information that you have. And then you realize, oh, wait, maybe there's more to this. Maybe this isn't the case. And then you start to dive into some research yourself. And then you see other resources, other mentors. And for me, I kind of got to the point where the magazines were kind of repeating themselves. And I knew what they were telling me. I knew it all. And I was probably the highest level of muscle and fitness education I could possibly get. And then, do you remember Jim Stepani?
Sure.
So Jim Stepani was my first outlet to getting out of the magazine and following someone with a PhD. And I said, all right, here's a guy who is in the lab. He's got, his ear to the pavement, and he also looks the part. He's got a doctorate. This is my guy. And then I kind of latched on to him. And that was maybe like a step up from muscle and fitness. There's still some like bro-ish science to it, but that kind of satisfied that itch for me there. And then I looked to like T Nation, and then you stumble across like Brett Contreras and even Brad Schoenfeld every once in a while, and Alan Aragon. And then that opens that world. And then I think I found 3DMJ from Matt Ogus around 2011, like around that time. And then that just completely satisfied that itch for me, because that's just what I was looking for at the time. Right. And same thing with physical therapy. You come out of school and maybe you have a mentor, and it's like the biggest guy in the gym, right? They're successful. They've been practicing for 10, 15 years, maybe a business owner, and you just follow them and what they do, and they teach you. But maybe the biggest guy in the gym isn't the most knowledgeable or the most evidence-based. Maybe he's getting results despite his methods, just like maybe the physical therapist is getting results despite his or her methods. So then for me with physical therapy, it was kind of getting into that online community, barbell medicine, clinical athlete, E3 rehab. Those are kind of like the 3DMJs of the physical rehabilitation world. So you kind of dive into those things. And then you have that existential crisis, just like when you dive into 3DMJ and you realize, oh my gosh, a lot of what I've been doing and what I've been thinking has been written in stone, may possibly isn't. And then once you go through that crisis in your mind, it also prevents me from feeling too sure about things in the future, because you know that feeling of getting flipped on your head. So yeah, my journeys through both of those things have been very similar.
Have you found with physical therapy that, because I mean, really, whether it's fitness or medicine or PT, there's, this evidence-based content, but then you find that, okay, well, maybe there's these things that a lot of people claim work, but they don't have a lot of evidence, or vice versa, right? One of the issues I have with physical therapy, and I'm actually going through this now with myself. Let me pull out this book. I don't know. We can get into your thoughts on Stu McGill here, but I got back mechanic. I'm like halfway through here, but I've been dealing with some pretty chronic back issues recently, and it's probably a combination of my profession along with just maybe not having, I wasn't really doing a lot of direct core work, and I think because I used to just, I was young and I was like, well, I squat, I deadlift, I do pull-ups and overhead press, so I'm good. But then I stopped doing as much squats and deadlifts, and I think that was maybe an issue too. So we can talk about that. But the point more just being that it seems like with physical therapy, a lot of the issues is that you have stuff that works, but it's not necessarily like somebody comes to me, they have an infection. Okay, we're going to do this. We're going to clear out the infection. Maybe we'll give you an antibiotic. Done. And it seems like with pain specifically and PT as well, there is this issue of a lot of confounders, right? There's regression to the mean, which for people who don't know, it basically just means, you might go to your physical therapist or your doctor when things are at its worst, but there's going to be a natural fluctuation. And so you go when things are at their worst, it might naturally fluctuate back down to its average point, but then you think, oh, well, it got better, right? There's a lot of placebo involved. I mean, how do you feel about that as a physical therapist who's seeing patients all the time?
You hit the nail on the head. I think the issue with our profession is I think it's impossible to rely too much on evidence, because at the end of the day, just like strength and conditioning and muscle growth, it's not a very like if we're talking about world problems, it's not, we don't have fantastic evidence to say, okay, this is definitely the answer. And like you said, something like pain tends to get better most of the time, despite what we're doing. So we can throw a lot of stuff at pain, and it can kind of just get better. And then we develop those narratives about why my waving my magic wand over you got your pain better. Then I can create a narrative. But I think the problem is the stakes aren't high enough. And if you compare it to something like cancer research, I don't know anything about cancer research, but in my mind, if you go to 10 different physical therapy offices and have back pain, you'll probably get 9 different diagnoses from those different therapists, and probably 20 different treatment approaches to that back pain. And maybe most people will get better. The problem is when you compare it to something where the stakes are higher. So imagine you went to 10 oncologists with lung cancer. I can almost guarantee you'll probably get the same diagnosis, same treatment. It'll be something similar because the research is just so much more clear, and we're innovating constantly with something like cancer. So if oncology was like physical therapy, there would be practitioners in jail, like making up false narratives about how to treat their cancer. People would be dropping dead on the street. So I think that's a problem. Kind of like you said, you have regression to the mean where things just kind of get better. And back pain, knee pain, it's not really something that is going to, end someone's life. So yeah, I think that opens the door for a lot of false narratives, and then people can just create their own courses and camps of thinking, and maybe it's based off of the same principles that work, but then the reasoning behind it perhaps is not accurate.
Yeah.